I'm going to demonstrate the appointment number 1 tray for Crown and Bridge. So the first thing we're going to do is pass the mouth mirror and Explorer, then place the topical. The doctor will give the injection. We will flush and aspirate. While the patient is getting numb, we will check the shade with the light on and off, write down the shade number and name of the shade guide. Then we will begin with the high speed. As the doctor is using the high speed, we will aspirate. He'll go to the slow speed. We will continue to air and aspirate, and then we will pass him the retraction cord in the cotton forceps and the retraction cord instrument so that he can put it down around the margin of the tooth. We will then have the patient bite down for 5 minutes. In that 5 minutes, we are mixing our material into our luting syringe and into our triple set tray. The triple set tray takes an impression of the bite registration, the working tooth, and the opposing arch. We will then remove that, pass the cotton forceps to remove the retraction cord, immediately pass the luting syringe so the doctor can lute around the tooth, immediately pass the triple set tray so we can take an impression, and that will stay in for 5 minutes. And again, if I didn't say it, it takes an impression of the working tooth, the bite registration, and the opposing arch. We'll stay in 5 minutes. Once that's done, it will come out. We will begin making our temporary crown, which includes using the crimping pliers and the crown and bridge scissors to make any adjustments, trim it down, make it fit properly. Once we have the proper fit, we will mix up our temp bond or our thin mix of IRM. We will lute the crown no less than half, no more than 3/4. We will then air dry and isolate the tooth, and then we will place the crown, and the patient will bite down for 5 minutes. In that 5 minutes, we'll wait, and then once that's up, we will use our Explorer to remove any cement around the margin of the crown, or dental floss with the knot to go through the interproximal to pull out any excess cement. We will then flush and aspirate. We will give post-op, which includes no extremely hot or cold food or beverages, no chewing on that side for the next 24 hours. Be careful of the numbness. Avoid chewy, sticky, tacky foods for the next 2 weeks. If the crown should fall off, do not throw it away. Come back in, we'll replace it, re-cement it on. After that, we will fill out the lab slip, which must include the patient's name, the date, the doctor's name, the bite or the special instructions, the kind of crown, the manufacturer of the shade, and the shade guide number. Any special instructions, the doctor's license number, name and signature, and due date, which is always due 1 day prior to the patient's appointment.